It's a problem many seniors and their families face. Chronic illnesses and multiple medications that make it tough for seniors to continue to live on their own. Like most seniors, Evie had a fervent desire to stay independent.
It's very important for me to be living at home and going where I want to go. Why do I have to go into assisted living unless it's where I become so incapacitated that I cannot stay home? But I want to stay here as long as I can, go wherever I want to go.
Often, it's up to children to make important decisions about aging parents' ability to live independently.
I think it's very hard for children to begin to make decisions for their parents, both because the parents often don't want to have decisions made for them, and the children aren't exactly sure what to do. Also, the children and the parents have to come to grips with the fact that they're getting older and that the parents aren't able to take care of themselves anymore. That's frightening for any individual who's facing that, but for a child who's seeing their parent, who was always their protector, the person who took care of them, now not being able to even take care of themselves, it's frightening on a lot of different levels.
We all want to remain independent as we age, but growing older brings a new set of challenges like increased risk of falls, depression, and the leading cause of hospitalizations among seniors, medication mismanagement.
Medications can provide great benefits but are not without risks, and seniors are particularly at risk for medication-related problems due to a number of reasons. Also, as we age, our bodies change, and some of those changes can alter the way a senior can handle or process or even react to a medication, and that can increase their risk of medication problems. And nearly 1 in 4 hospital admissions and nursing home admissions in seniors is due to medication mismanagement.
For seniors who want to stay independent, a support system including family, physicians, and other healthcare professionals can make all the difference.
I like to say that geriatrics is a team sport because lots of different kinds of expertise are needed to care for the needs of older people. We also need to have coordination and communication between all the different parts of the team. So having care managers, people whose job it is to tie all the different people on the team together and try and tie the parts of the system together is really helpful.
Thanks to her support team, Evie continues to live out each day to the fullest.
Well, I can do what I want, but I do want to stay home, be around my neighbors, having the family come over to visit and chat. I can't do without them, not at this point.
Evie and her family rely on Dovetail Health to help her live independently. Located in the greater Boston area, Dovetail Health offers customized services for seniors who need help managing chronic illnesses and prescription medications. It's a desperately needed service that is missing in today's reactionary healthcare industry.
It's no surprise that 90% of Americans want to remain home as they age. And for some people, they can't. But for the ones that we can help and provide monitoring and oversight in their homes, for instance, if somebody has congestive heart failure, to see a change in weight gain or blood pressure can make a difference on whether they can stay home or need to be hospitalized. So we can intervene earlier and help those people a lot.
Medicine does what insurance pays for. Insurance pays for days in the hospital. An average stay in the hospital for a senior costs $20,000. Yet insurance won't pay $200 to prevent that admission. Ultimately, our healthcare system cannot afford to ignore creative solutions to reduce the cost of care. With solutions like Dovetail, everyone wins. Seniors get to stay home, and expensive hospitalizations can be avoided.
Dovetail's care teams are made up of healthcare professionals who conduct regular in-home checkups, monitor medications, and develop personal relationships with each client. Dovetail also offers daily screening of vital signs through a remote monitor to catch the early warning signs of illness.
The remote telemonitoring device works for us in a few ways. It helps our clients send us important health status information, including blood pressure results, blood glucose results, or daily weight, so we can know the health status of our clients on a daily basis. Collection of daily biometric data is important because it helps us identify subtle changes in our client's health condition that warns us about impending health crisis. And it's a way for us to step in, dial up services as needed, and intervene to prevent a future hospitalization or ER visit.
If my weight goes up a little bit higher than than normal. Right away, Dovetail is on the phone. What did you eat last night? Take your blood pressure again, take your weight again.
Dovetail is a highly customizable service designed to provide each client with the individual care they need. Evie has benefited greatly from the support she gets from her Dovetail nurse and personal care coordinator, but it's her Dovetail pharmacist that has made the biggest changes.
We go over my meds to make sure that they're all, together. I'm taking my medications the way I'm supposed to. They explain everything to me. They have the technical knowledge, the patience, and the time that gives me a sense of independence.
Dovetail Health empowers seniors to take control of their health care and continue to live active, independent lives.
Geriatricians take care of patients with a lot of complex illnesses. Someone who has a complex illness requires help from a variety of different people, different types of physicians, different types of home care specialists or home care providers. So unfortunately, there's often lack of coordination or communication among the different providers involved. Unfortunately, our system currently lacks the people and the tools necessary to tie all of these systems together. That's what Dovetail does really well. Additionally, we have home safety assessments that we do, which also meets an important need that often isn't recognized by many other parts of the system. Finally, Dovetail's technology allows us to monitor chronic illnesses in between visits to physicians or other providers. When you put it all together, the coordination services that Dovetail provides and filling in the specific gaps in the system, it's an amazing package, and there are many opportunities that Dovetail has to help people stay home and stay healthy.
If medication-related problems were classified as a disease, they'd represent the 5th leading cause of death. So as a pharmacist, I feel seniors need support and strategies to help them effectively take and manage their medications so they can get the most benefit from them as well as minimize the potential risks of their use. And that's what Dovetail's clinical pharmacists and our programs do.
Dovetail is important not just because of the superb quality of service we provide or the medication management program that helps avoid medication errors in seniors, or the ability of our care managers to coordinate our clients' care across the healthcare continuum. But what I've found, and with our clients who are passionate about staying at home, it helps restore their confidence in their ability to remain independent and safe in their own home.
At Dovetail, we really believe we can have an impact on how Americans manage aging. This is a team sport. If we can help people manage and monitor their health conditions at home, we can make a lot of people in this world a lot happier. Ultimately, we believe we can have very positive outcomes in the marketplace. By managing and monitoring people's health, not only are we making people happier as they grow older, but we can have a real impact on how healthcare is reimbursed in the future.